Thanks for joining us online. My name is Ken Schaefer, and on behalf of our team, I'd like to welcome you to what we refer to as Mastering the Medicare Maze. If you're about to start Medicare, then you're going to need to make some decisions about your Medicare coverage. And let's face it, Medicare can be very confusing. There's dozens upon dozens of plans. There's complex government rules. There's penalties. There's an alphabet soup of letters. It gets to the point where very intelligent individuals who are about to retire can become very frustrated by the sheer complexity of it all. So what do? They cross their fingers and they ask the advice of a friend or a family member who typically has no more expertise than they do, and they end up selecting a plan that oftentimes end up not being the right plan for them. There's no lack of information when you're first starting Medicare. There's advertisements everywhere. Your mailbox gets filled up regularly. You end up getting phone call after phone call after phone call, and non-compliantly very frequently, I might add. It gets to the point where people can figure out Medicare in this fashion, but most don't want to. They don't want to spend weeks or months of their life trying to figure out a complex government program. The good news is they don't have to. That's why we're here today. I believe by the end of this workshop, you're going to know exactly what to do and when to do it. You're going to know how to enroll and when to enroll. You're going to understand the complex rules and the penalties. The fact of the matter is, I believe that Medicare is going to finally make sense. So let's go ahead and get started. All right. So I said that we're going to need to make some decisions if you're about to enter Medicare. What type of decisions are we talking about? Well, first, I believe there's going to be three key decisions, and we're going to kind of briefly talk about those before we kind of get into the meat of what is Medicare. The first decision is, do you sign up for both parts A and B at 65, or do you delay? Examples of when you may sign up for both or not, for just one part or the other could be as follows. If you're still gainfully employed and you're receiving some type of employer coverage that's considered creditable, then you may want to continue to keep your employer coverage and only enroll in Part A. By the same token, if you're actually contributing to, for example, a health savings account, then you may not want to select A or B if you're still gainfully employed and receiving employer coverage. On the other hand, if you're working for, say, a smaller employer and you don't have credible coverage, then it might make sense to enroll in both A and B. Or if you're already retired and you're coming from, say, Affordable Care Act coverage, sometimes known as Obamacare, in that scenario, then you're going to definitely want to pick up both A and B. And so let's say then that you've made the decision to go with A and B. In that scenario, then next decision that you need to make is, do you use original Medicare and a supplement, sometimes called a Medigap plan, or do you select a Medicare Advantage plan? And then finally, once you've made the decision of what type of coverage that you want, and by the way, we're going to go back and describe exactly what they are and why you might select one or the other. But then the final decision is going to be, all right, I've selected one type of coverage. Now, which company and which specific product might make most sense for me to be able to select? All right, makes sense? And so let's go ahead and keep going. Let's now talk about Medicare big picture. All right, so what is Medicare? Well, first and foremost, it's federally sponsored, and it's an individual health plan. What does that mean? For example, you may be familiar with Affordable Care Act, sometimes known as Obamacare. You may also be familiar with employer coverage. In both of those cases, you typically have one plan that might cover you, your spouse, your children, all in a single individual plan. With Medicare, it's always based upon one person, an individual. And so whether a couple, a husband and wife might have the same coverage, it would be because they explicitly chose the same coverage for each of them individually. Second thing, it's always going to require copays, coinsurance, and deductibles, unless, of course, the beneficiary has some type of secondary coverage. We're going to be talking more about that as we go through the presentation today. So who's eligible? Well, it's going to be anybody who's 65 years old or older and has participated in Social Security, the railroad retirement system. They're employees of the federal, state, or local governments, or whose spouse has participated in employment with one of those scenarios. It could also be made available to someone who's under 65 if they've been awarded Social Security or railroad retirement disability after having been on disability for 24 months. And in some cases, it can be done even quicker than that if they have been diagnosed with something like Lou Gehrig's disease or end-stage renal disease. All right, so what are the key components of Medicare? First is going to be Part A, which is going to be hospitalization. There's going to be Part B, which is going to be doctor's visits and things like that. Those are often known as original Medicare. We'll skip C for a moment. And then there's Part D, which is going to be drug coverage. So what does that leave? That leaves Part C, and Part C is a private insurance program that is connected to or is part of Medicare, if you will, where individuals get their Part A and Part B and drug coverage typically rolled into one package. We'll be talking a lot more about that as we go here. So what are the key components of Medicare cover? So Part A is, as I mentioned before, going to be hospitalization. It's also going to be things like skilled nursing care. That's not to be confused with long-term care, in which case someone maybe enters a nursing home and they're going to be there for the foreseeable future, maybe for the rest of their life. Skilled nursing is known as rehabilitative. In other words, someone has had something happen, maybe broke a hip, maybe had a stroke, something like that, where they're going to go through some type of a rehabilitation process and hopefully return home. Next one is going to be home health care. That can be either Part A or Part B, depending upon what's done. Hospice, if someone is determined to be terminal, is going to be Part A. Blood transfusions, things like that can be A or B, again, depending upon where done. Now, Part B is primarily going to be doctor's services, but it's also going to be things like outpatient surgery. Well, even when it's done at the hospital, if it's an outpatient where you're in and out the same day, it's going to be considered outpatient and it's going to be Part B. It can be home health care, as I said, it can be on either side. Durable medical equipment like canes, wheelchairs, walkers, CPAP machines, braces, etc. They're going to all be in Part B. Blood, as I mentioned before, can be either side. And then Part B drugs. And this is an important one because Part B drugs can include things like chemotherapy or allergy antigens. These are things that are going to be done in a doctor's office. It's a drug, but it's not going to be gotten from the pharmacy. And as a result, it's going to be covered under Part B. Also to note here, if you see highlighted there, is Part B services are generally covered at 80%. So something like chemotherapy, which can be very, very expensive, obviously, is 80%. And there's no maximum out of pocket associated with Medicare A and B by themselves. So I want you to kind of keep that in mind as we go through things today. That's one of the places that we want to make sure that we cover over time so that you're not left in a spot that's not desirable for yourself in terms of long-term expenses due to medical conditions. So what's not covered by original Medicare? Well, first and foremost, outpatient prescription drugs, which you're going to come to know as Part D. Part D is a part of Medicare, but the drugs are not part of original Medicare A and B. It is something that you can get through Medicare, but it's not going to be known as part of original Medicare. Routine dental care. It doesn't mean that there's not certain things that can be covered by Medicare, but for the most part, dental is not covered by Medicare. So things like cleanings, root canals, scalings, dentures, implants, all those types of things are not that are considered routine dental care are not going to be covered by original Medicare. There are ways to get coverage for them, but not through original Medicare. Routine vision care and glasses. Again, things like a refraction, a new pair of glasses, they're not going to be covered by Medicare. Things like macular degeneration, glaucoma, cataracts, yes, they will be covered by Medicare. What about hearing? If it's balance issues, vertigo, things like that, inner ear problems, yes, Medicare is going to cover that. But a general hearing exam or hearing aids, not covered by original Medicare. Foreign travel, cosmetic procedures, and again, long-term care is not covered by original Medicare. It's not covered by Medicare at all for long-term care. So for example, if you needed to go into a nursing home, don't expect Medicare to cover that. There can be scenarios where something like Medicaid might be able to cover that if you've gone through what they call the burn down period, where you've utilized all of your existing resources and now have no resources left that Medicaid can pick up. But Medicare does not cover long-term care. So what does original Medicare cost? Well, in general, Part A is going to be known as premium free for most folks who have worked at least 40 quarters or the equivalent of 10 years, and they've contributed to the Medicare system through FICA taxes. And even if you personally have not worked that amount of time or contributed FICA taxes for that period of time, if you have a spouse who has, you can also qualify for what's known as premium free Part A. However, I do encourage you, if you're starting your Medicare, to start that process maybe a little bit earlier, because sometimes Social Security doesn't have the information necessary to prove that you had a spouse or have a spouse who has that work history, and so that you can, again, make sure that you qualify for that premium-free Part A. If you haven't got a spouse, or you or yourself haven't worked for 40 quarters and paid FICA taxes for that period of time, then yes, there's going to be a premium for Part A. Part B, in general, always has a premium. In 2023, that premium is $164.90 for those individuals who are making less than $97,000 a year if they're filing singly, or who are making less than $194,000 a year if they're filing jointly. If you earn more than that, then there's going to be something known as an income-related monthly adjustment amount, an IRMA. That says if your income is higher than those limits, and they usually look 2 years past, so in 2023, they're looking back at 2021 tax returns. If your income is greater than that, then you're going to pay an adjusted amount up. One thing I want you to understand there is a form called an SSA 44. So let's say that your work history is changing as you're starting Medicare. A lot of people are retiring around that time, and you may have reduced employment income. In that case, there is a way to get kind of a redetermination where they will look at your current income once you start your Medicare. Part B is, again, typically going to be deducted directly from your Social Security benefit if you're drawing Social Security. If you're not drawing Social Security, then they're going to bill you quarterly. And here's a kind of a key tip, a pro tip, if you will. If you go to medicare.gov and set up a Medicare account, once you've got your Medicare number, you can go in there and there's a tab that says pay premiums. And from there, you can actually set up to have your Part B premium deducted from, let's say, a bank account on a monthly basis if you're not yet drawing Social Security. But again, if you're drawing Social Security, they're going to take it out automatically. They're not going to ask any questions. That's just where it's coming from. All right? So how do you enroll? Well, Medicare enrollment is going to be done through the Social Security Administration. You might think, hey, I'm just going to go out to Medicare.gov and I'm going to get enrolled in Medicare. Nope, that's not the way it's done. It starts with Social Security. And so you can go online, probably the easiest way, to www.ssa.gov, and there's going to be a link there for Medicare. You click it, you scroll down the page, and then there's going to be a link that says Start Medicare, and it's a very short process. If you already got a Social Security account, it's probably not more than about 10 or 15 minutes to go ahead and get your Medicare applied for. You can also call a 1-800 number and establish the process that way, or actually set up an appointment. If you prefer to do things face-to-face, you can set up an appointment at the local Social Security office. Now, I want you to understand this. You can be automatically enrolled in Medicare as well. If you are already drawing Social Security at the time you turn 65, you'll be automatically enrolled in Medicare. Or for that matter, if you've been drawing Social Security disability benefits prior to 65 for at least 2 years, you can also be automatically enrolled in Medicare. You don't have to go out there and take action on your own to make that happen. I do want you to understand this. You may say, I don't want to start Part B yet. I am drawing Social Security, but I'm still working and I still have employer coverage. You may not want to start Medicare, and then you can actually reject it if they were to automatically enroll you. And what you should understand is that your coverage starts the first day of your birth month, unless your birthday is the first of the month, in which case your coverage will start the first day of the prior month. So for example, let's say you were born on June 1st, your coverage would actually start on May 1st. But if you were born on, say, June 15th, your coverage would start on June 1st. All right, so let's say that you're not automatically enrolled. Well, you're going to have a 7-month window in which to enroll in Medicare if you're turning 65 and not drawing Social Security benefits. In other words, you're not automatically enrolled. That's going to consist of 3 months prior to your birth month, and 3 months after your birth month. This is important because if you miss this window, there can be penalties that will accrue that you'll end up paying for the rest of your life. So let's look at this window. If you enroll in the 3 months prior to your birth month, then your coverage will start on the first day of your birth month. So in other words, if you're born June 15th again and you apply back in April or May or something like that, then your coverage is going to start on June 1st. If you apply during your birth month or one of the 3 months after, then your Medicare will start the first day of the following month. All right. Now, the key again is remember is that if you miss that window, let's say you go past the 3 months after your birth month, that can result in lifetime penalties because if you don't have coverage, credible coverage from an employer or credible coverage through Medicare here, then what's going to happen is when you do eventually start Medicare, you will end up paying a penalty of 10% per year that you didn't have credible coverage that you could have been on Medicare. So important to understand. You do not want to miss this window of time to get your Medicare started. And not only that, it's also further complicated by there's something known as a general enrollment period. So if you don't hit that window, then you actually have to wait until January 1st to March 31st of a year to enroll in Medicare. It doesn't just, you can't just enroll at any point in time when you miss that window. All right. So key distinction. Next thing is, what if you say, well, I wasn't automatically enrolled and I don't want to enroll because I'm still working and I have great employer coverage. Well, if you're actively working and you have what is known as credible coverage through an employer, then you can delay enrolling in Medicare Part B without penalties. So what does it mean to have credible coverage? Well, first and foremost, if your employer has 20 or more employees, they must by law have credible coverage. Okay, so if you like that coverage and you'd rather not start Medicare, you don't want to have a Part B premium, whatever it might be, then you can continue with your employer coverage until which time you leave that employer coverage and then you can start Medicare. Then we'll talk about that in a moment. Now, note, I mentioned credible coverage. Well, what if you work with a company less than 20 employees? In that scenario, in many, if not most cases, their coverage will not be considered credible, partly because it's not required by law. And if their coverage is not credible, then you are going to need to start Part A and Part B, or you're going to be facing penalties, even if you were to continue to keep your employer coverage. Well, what happens if you start Medicare and you work with either size of company? Well, if the company is greater than 20 employees and it's considered credible, then what's going to happen is your employer coverage will be primary and Medicare would be considered secondary. If you work for a smaller employer and it's not credible coverage, then Medicare is going to be considered primary and your employer coverage would be considered secondary. All right, so what happens next if you have lost employer coverage, or maybe I should say are in the process of losing employer coverage? Well, one, sign up as soon as you can for Part B and Part D. But more importantly, hopefully you're planning ahead. I would actually encourage you to start the process maybe about 3 months prior to your leaving that employer coverage. So that gives you some time to kind of get through the process, make sure everything's working the way that you want, so that you have no gaps in coverage, et cetera. Now, technically, you do have an 8-month special enrollment period to enroll in Medicare once your employer coverage has stopped without penalty. Again, I encourage you to start the process long before that. Enrolling in Medicare Part B does, by the way, trigger a 6-month Medigap open enrollment period. We'll talk more about that a little bit later. But what I want you to understand is this: when you're leaving that employer coverage, there's going to be a couple of forms that you're going to want to know about. These 2 forms are first and foremost going to get your Medicare started. And secondly, they're going to do it in a way that you don't have any penalties. So what are these 2 forms? There's a CMS 40B, that's where you're going to get your Medicare started. There's a form on there, I believe it's line 12, where it's a remarks section where you can enter in the end date of your employer coverage. That then tells Medicare the date that you want your Medicare to start. They'll start kind of simultaneously. That coverage ends, Medicare starts. So if you're ending at the last day of a month, and Medicare starts the first day of the following month. And that's what the CMS 40B does. The CMS L564 is a form that's filled out half by you and half by your employer. And what it does is that ensures that you can get the information in that demonstrates that you've had credible coverage with your employer since you turned 65, and therefore will not have any penalties. So important for those 2 forms. Part D is a little bit different. So drug coverage, there can be penalties with Part D as well. And those penalties, as opposed to having an 8-month window of time, have a 63-day window of time in which to get your Part D started without penalty. Again, I would encourage you to start the process 3 months prior to your leaving employer coverage, so you have time to get everything in place, so there is no gap whatsoever. And again, you avoid penalties. All right. So what have I not hit here? One of the things that I have not really covered yet is Part A. You may be saying, you've talked a lot about Part B, you've talked a lot about Part D. What about Part A? If I am still working, should I take Part A? It's premium free, right? Wouldn't it make sense to at least enroll in Part A if I am continuing to work and I am Medicare eligible? I'm 65 or I've been on disability for a couple of years, whatever it might be, but I am now eligible for Medicare. Should I take Part A even if I'm still working because it's premium free? And the answer is, in many, if not most cases, the answer would be yes. You can actually start Part A even if you are continuing to work and not starting Part B or even Part D for that matter. The thing to keep in mind with Part A is there is one other kind of little known fact, is that if you have a health savings account and a high deductible plan with your employer or through the Affordable Care Act, and you're contributing to a health savings account, as soon as you start any part of Medicare, A or B, then you are no longer eligible to contribute to a health savings account. And so one other key factor there is, are you contributing to that? Do you want to continue to contribute to that? If so, it could be a reason to not take Part A. On top of that, if you are contributing to a health savings account, and let's say you say, I'm going to delay taking Part A. When you do eventually start Part A, they're going to do a 6-month look back. So what's going to be important for you to do is to make sure that you stop contributing to the health savings account 6 months prior to your starting A and B after, or along with leaving employer coverage. Okay, so important little, I guess, tidbit to add in there. All right, so we've talked about a number of things so far. We've talked a little bit about the 3 key decisions that you need to make as you're getting Medicare started. We've covered in more depth what you might want to do with respect to parts A and B, and when you might want to select them, and how they work, and how you get enrolled, etc. So what's next? What's next is going to be, what are your options with respect to secondary types of coverage? And first, there's Medicare supplements. Second, there's Medicare Advantage plans. And then there's something called other. And we're going to hit that one maybe a little bit less in depth, but other might be, for example, if you are a military retiree and have TRICARE for life, or you have federal or state retirement benefits. And we'll touch on them just a little bit towards the end, but our 2 key focuses are going to be Medicare supplements and Medicare Advantage plans, because that's probably where the vast majority of the people find themselves. So let's go ahead and get going. All right, so each of these different Medicare options, coverage options, are going to start with original Medicare Part A and Part B, as we've been discussing. The first solution is a Medicare supplement and a prescription drug plan that are added to original Medicare. Everything on this side, if you will, is going to be done a la carte. So you start with Part A and Part B, which have some gaps, as we have discussed. You add a Medicare supplement, sometimes nicknamed the Medigap plan, to fill some of those gaps. You add a prescription drug plan, because if you remember, Part A and Part B don't include drug coverage. You could add dental, you could add vision, you could add a cancer plan. A number of different additional things could be added to it and create a very robust, very comprehensive solution that a lot of people love. The next solution, we'll go into more depth on that in just a moment. The next solution is going to be a Medicare Advantage plan. And as opposed to building on top of original Medicare still has to be there with this type of solution. But effectively, in this scenario, all of the benefits get paid through the Medicare Advantage plan, and original Medicare pays out nothing on your behalf in terms of directly, for your benefits. A and B have to be there. You still have to pay the Part B premium, but all of your benefits get paid through this Medicare Advantage plan, which is administered by a private insurance company, a number of them out there. This plan, if the other side was kind of a la carte, where you build on it one piece at a time, this plan, you might say, is the buffet, right? So everything kind of gets wrapped into one package. It covers Parts A and Part B benefits. It typically is going to include drug coverage, it frequently is going to include dental or vision or over-the-counter benefit, et cetera. It's not like other things couldn't be added to it. You could still potentially, for example, get a hospital indemnity plan, you can get a cancer plan or whatever it might be, but it's a pretty comprehensive package. And again, I kind of like to look at it as the buffet if the other side is, again, going to be, a la carte. All right. And so these are the kind of the two things that we're going to now spend some time drilling down on, the two primary solutions that I find most people are going to have access to. Again, if they're not really focused on, say, TRICARE, VA benefits, federal benefits, things like that. Okay. So let's start first with original Medicare and building on top of it with a supplement and a prescription drug plan. Medicare supplements are standardized. So for example, the gaps that get filled are filled by a letter designation plan where those letters run from A to N. And yes, Medicare really is alphabet soup. You have parts A, B, C, and D, and you have plans A, B, C, D, all the way through N. And again, each of these letter designated plans fill certain gaps that exist in original Medicare. What had been the most comprehensive are plans C and F. However, if you weren't born before January 1st, 1955, you can no longer get, I should say, a Medicare supplement plan C or F. So you had to have turned 65 before January 1st, 2020. If you did, you can still get a plan C or a plan F. But again, if you weren't born before that, then you're going to be I guess, relegated, if you will, to plans A, B, D, G, K, L, M, N. You get the idea. And again, all these plans cover a certain set of gaps that exist there. One of the things to keep in mind, a plan A or a plan G or a plan N, they're the same regardless of what company you get them from. So a plan G is a plan G regardless of the insurance company that you might purchase that plan from. What's not the same is premiums. And so it's really important to take a look at what the premiums are for all of, say you're selecting a plan G, for all of the plan Gs that exist out there. And I'm not saying always you have to go with the cheapest one or whatever, but it should be a factor in your decision-making process as which one is going to give you the best value, if you will, for your money, because again, they have to cover the exact same set of benefits. Okay. So again, you should probably do a little bit of shopping around, which is again, something that we can help you with. So what do these different gaps look like? There's a whole laundry list. And yes, this is a bit of an eye test, if you will, but there's, for example, Medicare Part A coinsurance and hospital costs, and then you can add up to an additional 365 days with a Medigap or a Medicare supplement plan. There's Part B coinsurance. This is that 20% that we talked about before that I said could be such a big factor if you were to have the wrong set of medical conditions come up. There's Part A deductible, there's Part B deductible, there's Part B excess charges. There's a number of different things, number of different gaps that exist. If you look, C and F used to be the most comprehensive. Well, today the most comprehensive is going to be Plan G. It's the plan that I find most people go with. Another one that's pretty popular is Plan N. Doesn't say either one of those is going to be necessarily the right selection for you, but again, you can figure out which of these plans cover which of the gaps and how important is it for you that each of those gaps be covered, and you kind of select a plan from that perspective. Again, my experience has been that in recent years, as they're phasing out, if you will, C and F, that G and N tend to be some of the more popular plans that exist out there. And we'll drill down on this in a lot more depth if you were to decide that, hey, I want to go with a Medicare supplement and make sure that we select the right, Medicare supplement for you. So we'll move on past that. In addition to adding a Medicare supplement or Medigap plan to original Medicare Part A and Part B, you're also going to add a prescription drug plan. And anyone who has Medicare Part A or Part B is going to be eligible for Part D drugs. So for example, maybe you selected, Plan A or Part A while you were still working and you never got Part B. You could have actually selected a prescription drug plan at that point in time if it would have made sense. It probably wouldn't have, but if it had made sense, you could have added that Part D drug plan at that point. These plans are going to be sold by private insurance companies. They're going to have premiums associated with them, so they're not just given to you as a part of Medicare Part A and Part B. Each plan in general is going to cover a group of prescriptions, which is often known as a formulary. It's all the drugs that are covered within a given plan. And as of 2023, Medicare plans have 4 stages. There's going to be a deductible stage, an initial coverage phase, a donut hole, sometimes known as the coverage gap, and catastrophic. I want you to understand that some of these things are going to be hopefully be simplified as of 2020, 2024 and 2025 based upon some recent legislation. And plans and formularies do change annually generally. They could leave them the same, but for the most part, you should expect that your formulary and the plans are going to change on an annual basis. And again, remember that if you fail to keep credible drug coverage, whether it's through employer coverage or through a Medicare Part D plan, there can and will accrue penalties that will accrue against you that you'll end up paying for the rest of your life, again, once you do start that Part D plan. I could drill down a lot of additional depth, but just a few things to keep in mind is that in general, this formula that I talked to, this list of drugs that are going to be covered, they're going to spread them across a set of tiers. In general, you typically find that there's 5 tiers, where 1 is the most common generics, and then 2 is a little bit less common, 3 might be brand name drugs, 4 less common brand name drugs, and then 5 would be like specialty drugs, for example. So there's a set of tiers. In general, as you go up those tiers, the cost or the co-pays, co-insurance for those drugs will increase. So not only do you have multiple stages, again, deductible, initial coverage, coverage gap, catastrophic, you also have multiple tiers. So it's a relatively complex environment. And then you have, again, a bunch of different plans that exist out there. So how do you select which one is right? In general, here's my philosophy on that. We take a list of your prescriptions, we run it out against a website called Medicare.gov. It comes back with a price prioritized list on what it would expect that you would pay for the remainder of the calendar year for your prescriptions if you take them as prescribed. And I usually recommend that we select the plan that's the most cost effective for you. It'll come up first on the list when you're out there on Medicare.gov. We could try to second guess what drug you might be prescribed, but it's pretty hard to have that crystal ball and do that. And there's always things like formulary exceptions. So if a drug isn't on your list of in your formulary list, sometimes it can be added by a request from your physician. So there's a number of things you can do, but again, I usually recommend that we actually find the particular prescription drug plan that comes up most cost effective for you as designated by Medicare.gov. So when can you enroll in a Part D plan? In general, it's going to be during your initial enrollment period. If you remember before, we talked about there being an initial enrollment period that consists of a 7-month window. It's your birth month, 3 months before, 3 months after. You can also enroll in or make changes during the annual enrollment period, which runs between October 15th and December 7th. And if you do make changes, that plan will go into effect as of January 1st. Whereas if you enroll during your initial enrollment period, it would go into effect either at the first of your birth month, if you do it again leading up to that, or the first of the following month if you did it in your birth month, or any of the subsequent months, the 3 months after. In addition, there can be other times that you can make changes in your Medicare drug plan in some scenarios. For example, there's special enrollment periods where if maybe you move from one county to another county or one state to another state, there's in general going to be a special enrollment period where you can make changes or updates based upon that new area, that new service area, if you will, which is likely to have other plan options. There's also something called Medicare open enrollment, which runs between January 1st and March 31st, which is really there more for people who have Medicare Advantage plans. But if you have a Medicare Advantage plan, there can be scenarios where you might drop back to original Medicare, in which case you could pick up a prescription drug plan at that time. Again, we would work with you on any of that if you had questions about how that works, when it applies, et cetera. Something that I always want people to understand is that there are costs associated with your prescription drug coverage. They're not just giving this stuff to you. You're going to have a premium. There's likely to be a deductible. There's going to be co-pays. There's going to be co-insurance, depending upon the tier it's on, et cetera. For those who have less financial means, there is a program called Extra Help. It's a federally run program, and it can help to reduce or eliminate premiums, reduce the prescription co-payments and co-insurance, and can provide additional enrollment periods so you can make changes more frequently. If your financial means fall below that certain level, you can oftentimes qualify for Extra Help. It's something I always tell my clients, I hope you never qualify it, because I hope your financial means stay above that clip level. But if they ever do get there, it's so important to know that this program exists because it can be a real significant benefit to you if you do qualify for it. So we talked about the Medicare supplements and prescription drug plans. Now let's dive a little bit deeper on the other side that we kind of mentioned before, and that's Medicare Advantage plans, Part C. And again, remember, Part C in general combines A, B, and typically D into one package. Again, it's that kind of buffet solution, okay? So Medicare Advantage plans are going to be plans they're approved by Medicare. However, they're administered by a private insurance company. The way that these companies are paid, because I have clients ask me on a regular basis, how in the world can a Medicare Advantage plan offer a plan for zero premium? Well, first of all, remember, you're still paying Part B. You don't get out of that. But what happens is Medicare takes those dollars they believe they would have spent on your behalf if you had stayed with original Medicare, and that is paid on a per capita or a per person basis to the company that you select if you move to a Medicare Advantage plan. That's how these companies, how these private insurance companies are paid. They then have certain mandates that they have to meet. So for example, they have to be able to demonstrate that they're going to pay out as many benefits in general, on average, if you will, across to the whole population of clients that they serve, as many benefits as original Medicare Part A and Part B would pay out. In addition, they have to add a maximum out of pocket. If you remember right, original Medicare by itself, Part A and Part B, I said before that there is no maximum out of pocket. That's why that 20% can be such a dangerous place. Medicare Advantage plans are required to implement something called a maximum out of pocket, where if your copays within the plan for the calendar year ever add up to that number, then the plan pays 100% after that. So for example, let's say someone had a really terrible health scenario like cancer and they had to go for chemotherapy. In most of these plans, they'd probably pay 20% of the chemotherapy until it added up to that maximum out of pocket. And that maximum out of pocket each year is set federally by the federal government as a maximum, if you will, max out of pocket. Sometimes these plans set it a little bit lower than that. But again, there's a cap, if you will, on what that maximum out of pocket can be each year that's set by the federal government, okay? So typically, these plans, in addition to kind of how they operate, they're going to have a network of doctors. Keep in mind, original Medicare and supplements, their only network is Medicare itself. All supplements, for example, I kind of skipped this before, but all supplements will take all the same doctors that are taken by original Medicare. So any doctor that takes Medicare in the country will also take that Medicare supplement. Again, unless there's something called a Medicare Select supplement, not very common, they can actually have a network, but in general, Medicare supplements is all doctors that take original Medicare. And the Advantage side, that's not the case. There's typically going to be a narrower network of doctors than all Medicare. And it's going to, these plans are going to fall with between HMOs and PPOs. And we'll talk more about them in a moment, but they're, again, keep in mind, they're going to have a network of doctors. And it's so important that when you're selecting a Medicare Advantage plan, many of the plans have excellent networks, but that we review your complete set of doctors and the hospitals and all the providers that you might think are important to you, that we're going to verify that they are in network by the plan that you select, so that we have done our due diligence, that you're not going to have a surprise, that you're not going to all of a sudden not be able to go to one of the doctors that you've been utilizing for maybe a number of years, and that's a really critical doctor for you. So again, keep in mind, there will be networks of doctors, and it's so important to always check them. Here's another key fact. Medicare plans vary not just from state to state, but from county to county within a state. They're going to have what they call a service area. You might have a couple of adjacent counties that maybe have the exact same set of plans or whatever, but in general, they're going to be different between one county to the next county to another county, maybe 50 or 100 miles away or whatever that might be, right? And so it's so important that we check the plans that are available in your service area, because those are the only plans that you're eligible to enroll in. You can't enroll in a plan that maybe exists halfway across the country that maybe your brother or your sister or an old neighbor is enrolled in, because again, it's based upon where you physically live. Hope that makes sense. All right, so let's take a look at the network considerations. Again, remember, Medicare supplements, it's any provider that accepts Medicare anywhere in the country. But Medicare Advantage plans, they're going to have HMOs and PPOs, and the HMOs are going to be the narrowest, if you will, in terms of the doctors that are going to be accepted. And I'm going to kind of start from the most narrow scenario, and that might be a local HMO, which might just encompass the doctors, say in your county, maybe a couple of surrounding counties. There can be maybe a statewide HMO. It might be potentially a nationwide HMO. This is a little bit more of a more recent development. It used to be that they were almost always more narrow than nationwide, but there are a number of different carriers out there today that do provide nationwide HMOs where you can go to doctors, throughout the country. The thing to keep in mind with an HMO is that you must see a doctor that's in network, or the plan will not cover it, with one exception. And that's if it's an emergency. If it's an emergency, you can see any doctor in the country as if in network. In other words, the benefits would be paid as if that doctor was in network, whether they were or not, if it's an emergency. But otherwise, they must be in network for that plan to pay. A PPO, on the other hand, will have a defined network of doctors. Again, it could be local, it could be your state and the next state, it could be nationwide, but it's still going to be a network of doctors that's going to be a subset of original Medicare. And to get your best rates, you're going to want to make sure that you see a doctor that's in network. It is possible with a PPO to be able to see a doctor out of network. You'll just typically pay a higher copay or higher coinsurance if you do so. Now, with respect to HMOs and PPOs, I think there's been a little bit of a blurring of the lines in recent years. It used to be that with an HMO, you always had to have a referral before you could see a specialist, from your primary care doctor. There are many HMO plans today that don't require that anymore. Some still do, but a large percentage of them no longer require that. And again, a large percent of the HMOs have started to have even national networks. And so there's a little bit of a blurring of the lines, but still the one key thing that has not changed is HMOs, you must see the doctor that's in network or be an emergency report to be covered, whereas PPOs, you could go out of network and just paying a higher copay. Supplements, as I mentioned, again, any doctor anywhere in the country that takes original Medicare. And that's a scenario if somebody maybe travels a lot, maybe you have family in multiple different parts of the country and you don't know necessarily what doctors you're going to be seeing. That's where, for example, a supplement might shine. Okay. So when do you enroll in a Medicare Advantage plan? Well, generally during your initial enrollment period. We talked about this with prescription drug plans, same thing here. During your initial enrollment period, again, during the annual enrollment period, much like the prescription drug plans, between October 15th and December 7th. And again, those changes made during annual enrollment will go into effect as of January 1st. And then sometimes, again, special enrollment periods. You move to a new area. You have a new there's a service area reduction, or maybe a company says, hey, we're not going to service this area anymore. Pretty uncommon, but it happens. And so it's good to know that. And if that were to happen, you'd be given a special enrollment period. Also, for example, if you were to qualify for something like extra help or Medicaid, you're going to be given special enrollment periods when that happens. Or maybe if you're admitted to an institutional type of a scenario, a nursing home or a skilled nursing or whatever, in that scenario, you can also get a special enrollment period. And then, as I mentioned about an open enrollment period before, this is more open enrollment period typically applies more to Medicare Advantage, because basically what it's designed to do is if someone selects a Medicare Advantage plan, and because there can be a number of moving parts with Advantage plans, maybe they get started and a month later that, gosh, I wish that isn't the plan I had selected. I wish I had selected this one over here. And so when you select the Medicare Advantage plan, you have the first 3 months of the year, January, February, March, in which you can make a change. You also have the first 3 months after starting that Medicare Advantage plan. It was during your initial enrollment period, in which you can make up to one change to what they call a like plan or to return to original Medicare. Again, this open enrollment terms are very similar, but it should not be confused with annual enrollment. So again, what are your Medicare options? We talked about Medicare supplements and Medicare Advantage plans. Now we're to what I'm going to call other secondary coverage options. We're not going to spend a lot of time here, but if you're one of the folks who has a scenario like this, you're probably going to want to reach out to us and we can walk you through all the specifics that might revolve around your particular scenario. For someone who has Medicaid, there are certain plans that are available to those who have both Medicare and Medicaid they're not available to other individuals. TRICARE for life, military retirees. There are plans that I'm going to say are specifically designed, not that they're not always available to some of the other folks, but that are specifically designed to work very well with those individuals who have TRICARE for life. A lot of times people who have TRICARE don't even realize that there's other options that they can get that might not even cost them anything. There's federal and state plans that are designed specifically for, I should say, there's plans designed specifically for those who have federal and state retirement packages. And there's plans designed, again, much like the TRICARE plans are designed specifically to work with those individuals and potentially provide them with some additional benefits, and in many cases, not with any real incremental or added cost. There can be employer group health plans. These are becoming less common, but there are still some employers out there that offer healthcare coverage post-Medicare eligibility, even when an individual is no longer working as an active employee. Thing to keep in mind is these scenarios can often be used along with original Medicare or an Advantage plan and provide additional benefits. And again, I would encourage you, if one of those describes you, reach out to us and we can walk you through the various different specifics that exist there for you. So in summary, let's start to wrap things up. We talked about original Medicare and building on top of it with supplements and a drug plan and Medicare Advantage plans. Thing to keep in mind, there's a lot of parts here, right? The timing and the ability to make changes is not the same for all things Medicare. We've kind of hit on it, but let's see if we can kind of bring this to conclusion. So Part A and Part B, most people are going to enroll one time. There can be scenarios, maybe somebody starts Medicare and they decide they want to go back to full-time employment, and maybe that employer offers a great employee health care package that's credible. In theory, a person could drop Part B and then come back and get it again at a later date. Most people, however, they start A and B and they do it one time. Medicare supplements. In general, it can be changed at any time. However, you will go through underwriting that may limit your ability to make that change. So what I mean, when you first start Medicare, you're given kind of a clean slate, an open window. You have 6 months from the time your Part B starts to start your Medicare supplement, and nobody can ask questions and everybody has to give you their best rate. But once that 6-month window is closed, now you can make changes any time of year. You can make it every month if you want. It probably wouldn't make sense, but you can make it every month. But you're going to have to go through medical underwriting to be able to do that. And that means that you're probably not making changes to your Medicare supplement on a regular basis. Maybe your plan premiums go up to a point where you feel it's important to shop around again. Well, if you're healthy enough, you can probably make a change to another plan. But if you're not healthy enough, you may either have to stay on that Medicare supplement or shift gears and move to a Medicare Advantage plan, which never does ask underwriting questions. The blue boxes here, prescription drug plans and Medicare Advantage plans, these are going to be available to you during your initial enrollment period, but also during the annual enrollment, the open enrollment, and special enrollment periods. So let's wrap it up with annual enrollment details. Those blue boxes. What happens annually? What's available to you? Well, each year, typically in August or September, you're going to receive something called an annual notice of change for your prescription drug plan and your Medicare Advantage plan. The other plans don't really change, from month to month. Yes, your premiums can change, but the benefits don't. But drug plans and Advantage plans can and will change on an annual basis. So you can start to see those changes as of October 1st, where you can see all the details for all the plans that are available. But prior to that, each year, there's going to be something called an annual notice of change that's usually going to come in the August or September timeframe from the insurance company that you had selected, for that year. So maybe you selected company X, you've been using it for the year. Come August, September, they're going to send you a letter saying, here's what's changing for our plan next year. It's so important that you read that each year. If you don't open any other mail, open your annual notice of change so you can see is maybe the prescription that you're taking move to a different tier, which might affect your copay or co-insurance. Have they maybe decided that they're not going to keep a certain provider in network? Are they increasing or decreasing a dental benefit? Whatever it might be, right? Read that annual notice of change so you can see if this plan is going to continue to be a plan that works effectively for you or not. If you determine that after seeing the annual notice of change and maybe now being able to see what other plans are available out there, you decide that maybe that plan is not the right plan for you again in the next coming calendar year. Well, between October 15th and December 7th, you have an opportunity to make changes. You can reach out to us as an insurance agency. We'll walk you through it. We'll help you understand what plans are available. We can help you, go back through the selection process again and update your coverage. Any changes that you make during that window of time between October 15th and December 7th is going to go into effect on January 1st. Here's the key message. If you take no action, you will continue to have that plan the next calendar year with any changes that were made and identified during that in that annual notice of change. So it's so important, again, to take a look at the annual notice of change and make sure if you want to stay there or not. So what's next? Well, I'm going to encourage you to reach out. You can schedule a free consultation. It's not going to cost you a thing. We'll do the research for you. We'll ask you a number of different questions so we can find a solution that works well for you. We never try to pigeonhole somebody into a solution that, hey, you've got to go with a supplement and you've got to go with an advantage plan. There's a lot of solutions out there because there needs to be a lot of solutions. Everybody's got different scenarios, right? So we'll do the research for you, trying to figure out the right kind of coverage and as well as the right company and the right product. There's many, many companies, many, many products out there. We're going to do a review. We're going to look across those products and the carriers, and we're going to make sure that you're comfortable with them again. We're going to help you avoid the pitfalls, the timing to get things started, what forms, if you're leaving employer coverage, need to be sent in so that you don't have penalties. We'll be there relationship-wise for you year after year after year. I mean, think about it. If you call one of these 800 numbers, are they going to be there for you when you have questions, say 6 months from now or a year from now? Probably not. We want to develop a relationship with you where we get to know who you are and what your needs are so that on an ongoing basis, year to year, month to month, we're there to answer questions. We're there to help you find the products that are going to continue to be right for you today, tomorrow, next year, and for the rest of your life. So what's it cost for us to go to work for you? Absolutely nothing. We are paid by the private insurance companies that we contract with, and we contract with a very broad range of companies. We go to work for you to find a company that's going to work for you. It's going to work well for your needs. It's going to be cost effective for you. And the crazy thing is, if you went to that company without having our help, our assistance, and kind of doing that research for you and making sure that you have all the ins and outs, you're going to pay that company the exact same premiums as if you utilize us. Because again, we get paid by these companies. They pay us because they know that we're a resource to you, and we're going to essentially offload a lot of the work they'd have to do if we weren't there. So with that said, I really appreciate your time today. I hope you got a lot out of it, and we look forward to hearing from you.